Jill Cooper's story begins with a previous orthodontic alignment that produced straighter teeth. However, an uneven smile left her dissatisfied. Working in the dental field, Jill heard of the growing success stories of Lumineers patients and decided that she too could perfect her smile with Lumineers. Orthodontic treatment could not lengthen Jill's laterals or completely align interproximal spacing. She desired a seamless smile. Upon completing Jill's smile evaluation, observations included multiple diastemas, small maxillary laterals not level with other anterior teeth, a chipped left central, and discoloration. Her intraoral evaluation concluded adequate candidacy for the procedure with normal temporomandibular condition, no traumatic incisal relationships, and a good standing of periodontal health. Determined by the width of her smile, Jill's treatment included the placement of 8 Lumineers on teeth numbers 5 through 12. Jill chose the shade B0 for uniform whitening, and no cosmetic contouring was necessary. Jill is ready for her new smile.
So our patient wants Lumineers because she wants a more attractive smile, she wants her teeth straight, and she wants them a little bit longer, and she wants them to look natural, and she wants them to look white. So we're going to do 8 Lumineers today on our patient. And before we start, Lisa has polished her teeth, and what we like to polish them with is the Lumineers porcelain polishing paste. The reason we like to use that is because it has an enzyme in it to remove the plaque from the teeth. Now the first thing I like to do is to put on some paint on dental dam. And by putting this around here, it prevents the ultrabond from getting on the lingual interproximal surfaces. Now that's what it looks like on the lingual side. Now we're going to apply etch and seal to the labial surface. And if you think about what we're doing here is we're applying 2 solutions to the enamel, and Lisa has applied 2 solutions to the porcelain before we started. And she applied the porcelain conditioner, which is organic acid, citric acid, and then she applied Serenade Prime. Now that's the silane that activates this. The reason I use etch and seal is it contains aluminum oxalate. And so if I put this on dentin, the oxalate will seal the tubules and help prevent sensitivity. Right now I'm using tenure AB, and the reason I like tenure AB is it's not light dependent. You can put it on and it bonds to every single composite. There isn't one that it won't bond with, and if you don't get enough light to it, you'll still get a strong bond. Now I'm applying tenure S, and I go all around the surface of the teeth to apply the tenure S. Lisa calls out the name, and just like a pilot, if you ever watch them when they do their pre-flights, they call out a name or a direction, and then they repeat it. Right central? Right central. Okay. And you want to make sure you gently place these down. Right lateral. Then we'll go to the left side. Close your eyes. Close your eyes. And close your eyes. And I've spot cured all the Lumineers but the right lateral. I always want to stay away, 1 tooth away from that spot curing. And the reason is I don't want to inadvertently set some of the ultrabond if the Lumineer has gently slipped out of place. And you just want to make sure before you turn it, you see a little excess oozing out. Don't press hard. Okay. Now close your eyes. So now I take the brush and I look for all of the unset resin. Now I don't like the technique of partially bonding all of it and then having it gummy and flaking it off, because sometimes you flake it off between the margin of the porcelain and the tooth. And you can see this is beginning to polymerize in here. And now I can take my time in getting a lot of the excess off. A lot of people like to try to get it all finished before they polymerize it. And actually, I like to get it polymerized and then go in and do Dental Anatomy 101, because what you're going to do is carve on the tooth, the porcelain, and the Ultrabond. It's now all one homogeneous mass. And I'm being certain that I don't see any space between the porcelain and the tooth. I want to see Ultrabond covering that. Now, if you think about it, we're going to set 8 veneers. Close your eyes. Now that's about 1 minute. 8 Lumineers, 1 minute. Now we're going to remove the paint-on dental dam. Now I'll let you take a look at the lingual side. Without the paint-on dental dam in there, there's a little piece in there, and you can always know when it's paint-on dental dam because it's not tooth-colored. So now the first thing I'm going to do is take my 12-fluted burr with magnification and start removing the excess Ultrabond. And the reason I use 12-fluted is it takes out the Ultrabond rather aggressively. So you just take your time and follow the Ultrabond. See how I get in these embrasures? And I'm not trying to contour the porcelain yet. Now I'm scraping the Ultrabond off the labial surface with, and this is important, this is a Sure 349. It's an orthodontic instrument, and you can have your dental assistant or you can have your hygienist scale, because this is just like taking tartar off the teeth, except it's not tartar. I get about 90% finished, and then we have the patient back in a week. I like to keep the patients in the chair not more than an hour, hour and a half. Now I'm taking the needle nose tip and going up the interproximal embrasures and opening them. Now this is where I take the shoulder off the porcelain. So I want to blend this Lumineer to the tooth, and I want to get rid of that shoulder. And we won't get the whole shoulder removed on every tooth on this visit. We'll get most of it. So here's the football-shaped diamond, and I'm going to start off blending the bicuspid and the porcelain and the Ultrabond all together. And what you're really attempting to do here before you open your contacts is get as much Ultrabond as possible out of the embrasures. Now I'm going to take a long, narrow, ultrafine diamond, go on the lingual side, and open up the lingual embrasures. I see a little blue paint-on dental dam in here. You want to use a light feather touch. Okay. Open. Now close. Okay. Now grind your teeth around, forward and back, sideways. What I want to see is contact on the natural teeth. Now she has some Ultrabond in there, so we got to take that off. And generally the high spots in the posterior are where you have Ultrabond, because it blends with the tooth. It's pretty, even with magnification, it blends in so well. Now what we're going to do is open the contacts. And I'm taking a seri saw and I'm applying pressure. But once my sawing runs into some resistance, then I rock it to the gingival area. So I've got almost all of the contacts open. There we go. Seri Sanders, what we just do this on a couple here. And this is what orthodontists use. Okay. And she's happy, right? Would you say you're happy?
I think it makes a big difference. Your smile makes a big difference. It's the main focal point of whenever people are talking to you, whenever you're presenting yourself. And I'm also in sales, so that's something where I'm talking face to face with people all the time, and having a nice smile, having white teeth, having a uniform smile makes a big difference to me.